So health experts in South Africa are expressing concern over the steady increase in COVID-19 cases that we've seen in the last 2 weeks. In fact, some are warning that the country is already in the fifth wave of COVID-19 infections. The health department is today expected to hold a media briefing to try to chart a way forward. Let's get your sense of what we should be thinking about, bringing Professor Mosa Moshabela, who's the Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal. Prof, always great to see you. Thanks very much indeed for making time. So what we've heard so far is that the surge that we're seeing is currently being driven in part by the BA4 and BA5 sublineages of the Omicron variant. I hope that's clear enough. In what way does this change materially how we should respond to this pandemic, if at all?
Good morning, Ayanda and the viewers. I think the first thing that it changes that we haven't seen before is that if you'd recall, in the previous waves, we've always had a substantively different variant. So the likes of Beta, Delta, and Omicron in the fourth wave. But to now have a same variant, which is Omicron, drive another wave is something that we have not seen before in this country. And we have always sent out the message that a wave is driven by a new variant. And right now we don't necessarily have a completely new variant. Instead, we have a subtype of Omicron. And this is the subtype that is the 4 and 5 that you've mentioned are the ones that are driving the current infections at the moment. So it is not something we've seen before. It changes, and it also then changes the message or the understanding. So, COVID-19 keeps surprising us in that way, and I think that is important to note.
Yeah. In a context where waves are inevitable, are we better off than dealing with a variant that we know than a new variant that might complicate, for instance, a response to vaccines, for argument's sake?
Yeah, this is important, and it's very interesting because at the moment, scientists are still busy studying these subtypes that you've spoken about. In November, December, in the fourth wave, it was BA1 and BA2, but now it's 4 and 5. And so we're trying to understand exactly how transmissible it is, and it looks like somehow these subtypes are transmissible enough to actually drive the infections. Also, we're trying to understand whether they can escape immunity. We don't have the evidence yet, but the indications, the signals that we are getting is that people are getting reinfected, and the rate of reinfection is high. And whenever you see reinfections happen, it means that the virus you're dealing with is able to break through the wall of immunity in some way that has developed from previous infections or from vaccines. So that is in itself an indication that this virus may have attributes for that. And we've also looked at the mutations. Those mutations we have seen before, and they suggest that actually it's got characteristics that can drive a wave. We don't know yet about severity of disease. At the moment, we don't have any signs that it's causing severe disease, but we are still observing that. It's only been 2 weeks. Maybe in another week, we'll have a better indication. So I would say to you, Ayanda, and to the viewers, that I think that we are dealing with sublineages or subtypes, as you said, but in themselves, they have enough characteristics and makeup, a genetic makeup in them that has the potential to actually keep driving the increase in infections.
Yeah. You touch on the immunity question, which has lingered from the moment COVID-19 hit our shores, because last I checked, there is still no clarity around how long immunity from infection lasts and how that compares to immunity from a vaccine lasts. I mean, in that space, in that world of uncertainty, how should we be responding to this fifth wave?
Yeah, no, it's challenging, and the immunity question is quite complex. I think the things that are easy to see for us in South Africa, somehow we are in a unique situation compared to other places. There's usually a good gap of about 3 months to 4 months between waves. And essentially, the argument that we have and the consensus we have is that that gap represents the period it takes for immunity to wane. It may be waning of immunity from the last wave, but it's most likely waning of immunity from the wave before. So people who were protected in the fourth wave because of infections in the third wave are no longer protected in the fifth wave. So that period generally, Ayanda, is something that we think represents the process of waning immunity. But we think that the waning of immunity is largely got to do with one arm of the immunity, which is the antibody arm, which really protects you from the sort of exposure to infections. But we think that the cellular immunity, which is the second arm of the immunity, which protects you from severity of disease, does not necessarily wane as much. So in a way, that's why most of the time you'll hear scientists saying that, well, we expect to see infections, but we don't necessarily expect to see severe disease. And it's because of that. And we think that, that second arm of the immunity may be sustainable also in terms of exposure from infection, but we don't know for sure. We think also that immunity from infection may be too narrow compared to immunity from vaccination, which we have seen to have been broad enough.
Yeah, it's another, if you like, point for vaccines, but surprisingly, That's still a very contentious discussion, so maybe I'll steer clear for it. But I want to speak a bit more about the second arm of immunity, as you put it. I mean, that to me sounds like what should be the rate-determining step when we think about how quickly we should move in response to any wave, including this one.
Yeah, no, I think so. I think that in general, you will hear a lot of scientists who believe strongly in the second arm of the immunity, saying, well, we don't need to worry. We'll see infections and we'll see them every season, but the body will be able to protect most people from severe disease. But at a population level, this, I think, could be true, and I'm comfortable with it. But the problem is at an individual level. We don't know who is going to be protected, who's going to have severe disease, and who's not. At an individual level, each and every one of us ought to be doing everything that we can to make sure that we are prepared for a wave and we are protected and we follow precautions. This is the issue, and I think that sometimes we forget, because oftentimes we just talk about these things and we don't specify whether we are speaking from a general population level, which is sort of averages of everybody, or from an individual level. Individual risk level is something that we don't fully understand. So I would say that, in addition to what we know in terms of age and comorbidities, we have seen people who don't have those who end up in ICU. So it's important that each person understands that, we have to help our immune system as much as possible to be able to protect us. We may not be able to protect ourselves from exposure to infection, but most likely we may be able to protect ourselves from ending up in a hospital or ICU.
Yeah, it's important nuance that you're bringing into the conversation, because typically the state, and we know that the health minister is going to speak later today, will be concerned about the community interests, as it were. Yeah. But what you're pointing out is that, it's a bit more complex when you drill down to individuals. And so if the state is not really going to be able to police what individuals do, what becomes your advice as health experts about ways through which individuals, through their own agency, respond to the swift wave instead of waiting for legislation to kick in, telling them what to do?
Yeah, and I think this is very important. This is another first. The second first that we are seeing is that this is the first time we are seeing a surge in infections after the state of disaster has been terminated. In all the previous waves, we always had the state of disaster, and that's why whenever we had a bit of a crisis, we would resort to the legislation. But right now, I think that there is a clear distinction that I am now trying to articulate, which is that the state is concerned mostly with the health system and the ability of the health system to cope. That's what I think. For as long as there's no pressure on the health system, the state is unlikely to introduce new restrictions and laws and so forth, right? But that does not necessarily prevent the population and individuals bearing the burden of COVID-19 infections. As it is, a lot of people are having COVID-19. Many don't even know. And unfortunately, those who don't know are not necessarily going to be protected from the long-term consequences of COVID-19, like long COVID. They can still have it, but they will not know that they were exposed to COVID-19. So I think that the issue of personal responsibility is encapsulated in this notion of us now having to be responsible to protect ourselves from infections and to protect ourselves from mild disease. Because then the state, the government is not going to intervene there. We are going to have to deal with that ourselves. And then we have to use mechanisms and measures that we already know that we have employed in the past. But only now when the person gets seriously sick and they need hospital, I think that's where the state is going to pay attention. I just feel, Ayanda, that people have not been given enough tools and are not empowered, in many regards and in many areas, especially people who are socioeconomically disadvantaged and disenfranchised, don't have the tools to be able to look after themselves. But personal responsibility requires for us to have the knowledge, the skills, the tools, the resources, and the time and the ability to look after ourselves.
Sobering insight as we enter this new chapter of our fight against this pandemic. Professor Mosa Moshabela, always a great pleasure speaking to you, sir. Thanks very much indeed for your time. Professor Moshabela is the Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu-Natal.